My name is Trent Sutton, and I'm presenting on the Verb Network Strengthening Treatment. The Verb Network Strengthening Treatment, VNeST, is a treatment for aphasic individuals designed to improve word retrieval and sentence construction. Participants work through a series of steps to generate, read, and use verbs in various scenarios. The outcome is to improve word retrieval and for these improvements to be generalized to the sentence and discourse level. The mechanism of this treatment is based on the theory of event memory. This dictates that verbs and nouns form neural networks in the brain through use in world knowledge. These networks consist of thematic roles, including agents who perform the action, patients who receive the action, instruments, tools used to perform the action, and locations where the action occurs. Neural coactivation is when verbs and their related thematic roles activate each other in the brain. Agents and patients activate related verbs, and verbs and instruments bidirectionally activate each other. This treatment was created to treat individuals with aphasia, specifically those who present with anomia, or word-finding issues. It has been demonstrated to be effective for those who have a comorbid diagnosis of apraxia of speech. Contraindicated diagnoses are global aphasia because individuals with global aphasia typically do not have comprehension skills adequate to carry out this treatment. Additionally, individuals with apraxia of speech that is greater than mild to moderate are not appropriate for this treatment. The materials you need to carry out this treatment are simply cards to represent verbs, agents and patients, and WH questions. You also need a writing utensil and material to write on. The treatment consists of 6 steps. Step 1, the objective is to elicit agent and patient nouns that match the target verb, with the agent being the noun doing the action and the patient being the noun receiving the action. For this step, you will set down the cards with who and what written on them, then prompt the client to generate nouns representing who might verb something, and provide cues if necessary. You, or the client, will then write the generated who and what nouns on cards and put them under their respective category cards. You're going to repeat this step several times. In step 2, your objective is to practice reading the agent-verb-patient combinations aloud. You're going to instruct the client to read each row of cards in agent-verb-patient order. Move the verb card down as you do so. You may provide choral reading or repetition for participants who need that support. In step 3, your objective is to deepen their understanding of the scenario through the use of WH questions. Those questions are where, when, and why. In this step, you're going to ask the participant to choose a scenario and then have them answer corresponding questions. You may provide clarification if they don't understand the questions. For example, for the question, where does your dad drive a boat? If they don't understand it, you may provide the additional follow-up question of, what is the location or place? In step 4, your objective is to have the client evaluate sentence appropriateness. To do so, you will start by removing all the cards. Then you will tell the client that you will be telling them some sentences using the verb you've been working on, and they will need to identify whether or not the sentences make sense. You will provide 12 sentences from 4 different categories. These categories will include a correct sentence, sentences with an inappropriate agent, sentences with an inappropriate patient, and sentences with a thematic reversal. For example, the pizza eats the dad. In step 5, your objective is to have the client independently retrieve the target verb. To do this, you will simply ask the participant to recall and state the verb they've been working on. If they're unable to do so, you may provide cues. If cues are not enough to elicit the verb, you may provide them the verb card and instruct them to read it out loud. In step 6, the final step, your objective is to allow the client to generate agent-patient pairs without cues. To do this, you will keep all materials away and repeat step 1. This entails taking the verb and asking questions to elicit the agents and the patients. For example, who drives something? And what does the police officer drive? After completing step 6, you're going to repeat these 6 steps with more verbs. It's advised to train 10 verbs and cycle through them a second time. Ideally, you want to try to get through all 10 verbs in 1 week. This first study is titled, Effect of Verb Strengthening Treatment on Lexical Retrieval of Content Words and Sentences in Persons with Aphasia. The participants in the study were 4 monolingual English-speaking individuals with aphasia who present with significant lexical retrieval deficits. The results found that, regarding generalization, participants 1, 2, and 4 met the generalization criterion for untrained items. Participant 3 slightly missed this generalization criterion. Regarding maintenance of generalized items, participants 1 and 3 met the criterion for this generalization. The second study is titled Effect of Verb Network Strengthening Treatment in Moderate to Severe Aphasia. The participants in this study were 2 monolingual English-speaking individuals with aphasia who present with significant lexical retrieval deficits. The results for patient 1 found a small effect size for trained items and a negligible effect for untrained items. For participant 2, they found a large effect size for trained and untrained items, and a small effect size for both 5 months post-treatment. The third study is titled Effect of Verb Network Strengthening Treatment in Persons with Aphasia, Extension and Replication of Previous Findings. The participants in this study were 11 monolingual English-speaking individuals with aphasia. The results found that there was no notable change in the use of untreated sentence types at the post-treatment assessment. However, significant improvement was found in the maintenance assessment 1 month later. Discourse samples showed moderate gains in the number of complete utterances and the amount of meaningful content shared. The fourth study is titled The Effect of Computerized Verb Network Strengthening Treatment on Lexical Retrieval in Aphasia. The participants in this study were 2 monolingual English-speaking individuals with aphasia. The results found that, regarding spoken language, the 2 participants demonstrated improvements in lexical retrieval and the rate and number of utterances that were semantically and syntactically complete. For typed language, patient 1 demonstrated longer utterances and significantly fewer neologisms. Patient 2 did not demonstrate significant improvement in typed discourse. The fifth study is titled Effect of Mandarin Verb Network Strengthening Treatment in Mandarin English Bilinguals with Aphasia. In this study, researchers adapted VNeST to Mandarin. Participants were 2 Mandarin English bilingual individuals with aphasia. The results of the study found that, regarding within-language generalization, both participants demonstrated improved word retrieval for both trained and untrained items. Regarding cross-language generalization, both participants demonstrated just a modest improvement in word retrieval for both trained and untrained English items, indicating some cross-language generalization.